7 ways to detox and cleanse your kidneys naturally. The kidneys are without a doubt one of the most essential organs in the human body. They aid in removing waste, the maintenance of fluid intake, and the filtering of nutrients and harmful chemicals in the blood. If you want to take good care of your general health, you should concentrate on your kidneys and urinary system. In this video, we will go over 7 simple ways to detox and cleanse your kidneys naturally. Make sure to watch all the way to the end to learn about a technique that far too many people neglect. So if you're up to it, let's get started. Just a friendly reminder that this video is strictly for educational purposes only. Number 7. Herbal Teas. Herbal teas are an excellent approach to cleanse your kidneys and avoid dehydration. Herbal teas have been used to treat a variety of ailments for thousands of years. Everything from weight reduction to full body cleanses. And they're also used to detoxify the kidneys, as I'm sure you're now aware. Herbal teas are generally high in antioxidants and anti-inflammatory properties, which keep the kidneys operating efficiently. Studies have indicated that they may also lessen the chance of kidney stones in addition to other cleansing advantages. Kidney stones are excruciating. While they may not sound like a big deal, individuals who have dealt with kidney stones know just how bad they can be. Kidney stones are hard deposits that must pass through the whole urinary system to leave the body. Dandelion tea, marshmallow root, juniper, nettles, parsley, and ginger tea are some examples that you may want to try to prevent painful kidney stones. Stinging nettle in particular is a natural plant that has been utilized for herbal treatment since ancient times. It includes beneficial chemicals that aid in the reduction of inflammation. It also contains antioxidants which battle free radicals that cause oxidative stress in the body. Powdered nettle leaves are also diuretic and depurative. It clears blockages in the urinary tract, lowers uric acid levels, and kills microorganisms. This helps prevent urinary tract infections, or UTIs. When you drink nettle tea, your kidneys are forced to release more water, cleaning away more creatinine, metabolic, and toxic waste from your body. Because nettle leaves are high in iron, they may also be used to treat renal anemia. Blood cells flow into the urine in people with nephritis and renal issues, causing hematuria. Red blood cell formation, as well as critical minerals and vitamins, are boosted by nettle leaves. Nettle tea may be made by either pouring hot water over nettle leaves in a cup, or adding them to boiling water and allowing the water to become bright green. Make it as strong as you want. Number 6. Take the right vitamins and supplements. Taking the right vitamins and supplements is the next step in detoxing your kidneys. Like your lungs, your kidneys need the right vitamins and minerals to function properly. Vitamin B6 is one example that should be mentioned to keep them operating correctly. According to research, this vitamin lowers calcium oxalate levels, which reduces the incidence of kidney stones. Andrographis is another supplement you should know about. According to research, this plant has characteristics that may help reduce the damaging consequences of alcohol intake. In this area, additional study is required, although the test results are encouraging. Other kidney-friendly vitamins and minerals include alpha-lipoic acid, moringa, acetylcysteine, resveratrol, vitamin D, and even probiotics. Before introducing any extra supplements to your routine, it's always a good idea to consult your doctor. They will be more knowledgeable about your particular condition. Number 5. Limit salt consumption. Limiting salt consumption is the next step in detoxing and cleansing your kidneys. You're certainly not alone if you consume a high sodium diet. The typical American consumes roughly 3,000 milligrams of salt per day, which is higher than the recommended dose. According to the revised dietary guidelines for Americans, adults and children should consume no fewer than 2,000 milligrams of salt per day. Sodium consumption should be reduced to 1,000 milligrams per day for persons 51 or older, African Americans, and persons with diabetes, hypertension, or CKD. Too much sodium is bad for your kidneys. A high sodium diet raises the quantity of calcium in your urine, increasing your risk of kidney stones. Furthermore, salt may produce high blood pressure, which has detrimental consequences on the kidneys by weakening the arteries that supply blood, eventually leading to renal failure. Limiting the number of processed foods in your diet is a simple method to lower salt consumption. This brings us to the next technique, and that is to consume foods that are beneficial to the kidneys. Number 4. Eat fruits, vegetables, and fish. We've officially stated that consuming high-sodium processed meals is bad for your kidneys. Instead, choose fresh meals that are high in minerals and antioxidants to give your kidneys a boost. You've probably heard the adage, an apple a day keeps the doctor away, right? This includes the renal doctor. Apples and other fruits are high in antioxidants, vitamin C, and fiber, all of which have anti-inflammatory characteristics and may help your kidneys. Cauliflower, kale, spinach, cabbage, and sweet potatoes are some excellent fresh veggies to explore. Each of these superfoods has vitamins and minerals that have been shown in studies to aid in the detoxification of your kidneys. You should also consider including more fish in your diet, since fish is high in omega-3 fatty acids, which have been shown to considerably lower the risk of end-stage renal disease or postpone its development. Sure, these meals are healthy for your waistline, but now you know how beneficial they may be to your kidneys as well. Number 3. Stay away from artificial sweeteners. Another easy technique to explore is to stay away from artificial sweeteners. You may have previously made dietary changes to replace processed sugar with artificial sweeteners to be healthier and eat fewer calories. It seems obvious that eating fewer calories would result in weight loss. Regrettably, research has shown that the contrary appears to be true. Artificial sweeteners have a really harmful impact on our sense of taste, causing an increase in hunger and overeating. This leads to weight gain, which raises the risk of a stroke, high blood pressure, and cardiovascular disease. To top it off, there's an increased chance of type 2 diabetes and renal disease due to all of this. Sucralose, found in Splenda, saccharin, and aspartame, are the most prevalent culprits. Use natural sweeteners like honey, maple syrup, and agave nectar instead. Just remember to keep it in proportion. Number 6. Do a 2-day kidney cleanse. A 2-day kidney cleanse is perhaps one of the most efficient treatments for cleansing the kidneys. This is a strategy where you set aside 2 days to only eat and drink food and beverages that are good for your kidneys. As previously stated, your kidneys serve as the body's filtration mechanism, eliminating pollutants and waste. Your kidneys can really flush out throughout this time period if you just eat the right nutrients. To get your renal system in the best possible shape, you need to get rid of the majority of the extra toxins in your body. This diet may consist of any mix of juices, teas, herbs, smoothies, and meals that exclusively function to boost your kidneys' overall health. Number 1. Hydration. Staying hydrated is perhaps the most crucial step in detoxifying your kidneys. Drinking plenty of water makes it simpler for the kidneys to do their job, which is to remove toxins and waste from the body via urine. This indicates that the greatest sign of dehydration is urine. To verify, just look at how much urine is generated and what color it is. The average individual excretes about 6 cups of urine every day, so if you're not urinating often enough, you're probably not drinking enough water. You should definitely boost your healthy fluid intake as well. Your urine should also be clear or mostly clear in color. It's okay if it has a slight yellow tone, but if it's dark yellow, you're probably dehydrated. The great news is that as you drink more water, the color will lighten and become clearer. Dehydration may also cause headaches, dry mouth, disorientation, and weariness. If you frequently experience any of these symptoms, drinking extra water will help your kidneys function better and will help you feel better. However, many individuals wonder how much water they should drink on a daily basis. While the standard advice is 8 glasses of water each day, every individual is unique, and your body might need more or less. Instead of calculating your glasses of water, check for the warning signals we described earlier with urine, and test how much is best for you. There may be some other foods and supplements that may not have been described in this video. You can always conduct your own research to determine what you believe would work best for you. Keep in mind that the National Center for Complementary and Integrative Health notes that there is still no medical proof to show that these cleansing regimens are absolutely proven. Still, anecdotal data from people suggests that they are. However, it's always a good idea to see your doctor first, especially if you have an underlying condition. The majority of us can keep our kidneys in good condition by eating a nutritious diet and drinking enough water. However, with this video, you have several different strategies to explore. I hope you found the information in this video useful, and that you're now one step ahead of taking better care of your kidneys, and as a result, your overall health. Please bear in mind that we are not professionals, and this video is for information purposes only. While we're at it, we'll also give you these golden rules to keep your kidneys healthy. Maintain an active lifestyle. Maintain healthy blood pressure and sugar levels. Try not to use anti-inflammatory or pain relief drugs on a regular basis. Remember to drink plenty of water. And if you have one or more of the high-risk factors such as diabetes, hypertension, obesity, or a family history of illness, get your kidney function evaluated. I'm curious to know which of the ways you'll prefer to try. Which ones will you be putting into practice and putting to the test? Please share your thoughts in the comments box below. If you like this video, please subscribe to our channel and click the bell symbol to be alerted when we post more informative tips like this. Take care of yourself and stay healthy. Thank you for watching, and I hope to see you again soon.